books, which are actually all three of them are bestsellers, which is exciting. Now, a bestseller in orthopedic textbook means that we sold like 2,000. So it's not quite. I'm not some famous author or anything like that, but I do enjoy education. I also enjoy contributing to the orthopedic continuum of care and specifically shoulder care. And I've unmute. Okay. Okay. Can you hear me now? Everybody good. Okay. So I've got 6 patents, and I've got about 4 more in the works. Patents take a while to get through, but so I've contributed to a fair amount of products in the shoulder realm for a company called Arthrex. Let's see. So let's get to the shoulder. So first, some basic anatomy. You know, the shoulder is the most mobile joint in the body, and it's one of the reasons I loved learning about it, because it's the most complex joint in the body because of that mobility. Altogether, there's about 17 muscles that attach to the shoulder. There's ligaments, tendons. There's all kind of stuff going on in the shoulder. So sometimes it's a little hard to diagnose and to treat. Some of the common shoulder problems that we'll talk about are bursitis and tendonitis, rotator cuff tears, frozen shoulder, labral tears, and arthritis. Spend a little more time on the rotator cuff. So the bursa, first of all, is a fluid-filled sac. Every joint in your body has these fluid-filled sacs that live around the joint, and they act as a cushion for when you move the joint. Okay, normally there's about a half a cc or maybe 1 milliliter of fluid in the bursa, so it's not a lot of fluid. But sometimes, for whatever reason, maybe you sleep on it wrong, maybe you injure it, maybe it's a chronic problem, maybe it's a bone spur issue, but the bursa can get inflamed or irritated, and that's where you start to get some pain. So some of the symptoms that are common with shoulders are overhead symptoms, pain with overhead. Pain in the arm is one of the most common. Okay, sometimes it doesn't occur just in the shoulder, but it goes down into the arm or even up into the neck, like in the trapezius region. So pain that radiates. Overuse pain, when you use it, the more you use it, the more it hurts. There's something you may have heard of. It's called impingement. That means when you lift your arm, that bursa and sometimes the rotator cuff gets pinched underneath this bone called the acromion. So this is the acromion, this bone right here that I'm pointing to. Can you see my pointer? Yeah, so this is the acromion, and when we're born, we have this nice, straight, flat acromion. Well, the deltoid muscle is attached to the acromion, so a lifetime of that deltoid pulling on the acromion, eventually it'll pull all of us into this shape called a type 2, where it's got a little bit of a curve to it. And that's usually not a problem, but when it gets to this, where the curve goes way down like that, that's a spur, okay? And that's where that bone, or that spur, this spike right here, starts to dig into the rotator cuff or the bursa and causes problems. So that's what when you've heard of a bone spur or impingement, you get pinching of the rotator cuff underneath this spur. So the rotator cuff tendon sometimes can get pulled off of the bone, and this is called a rotator cuff tear. Now, 80% of the time, these happen slowly over time. A lot of patients say, well, when on earth did I tear my rotator cuff? I don't remember doing anything. I don't remember hurting myself. 80% of the time, you can't put your finger on exactly when or why it tore, but slowly over time, it just weakens and that tendon tears. Now, the other 20% of people, they know exactly when it tore. They fell, they had some type of, they were lifting something, and all of a sudden they felt a rip, so they know when it tore. And these tears, they can be all kinds of types. There's 4 muscles that are associated with the rotator cuff, and it could be 1 of them, 2 of them, or even, well, I've only seen all 4 like 3 times. So it's very seldom is it all 4, but I've seen 3 a bunch of times. Or it could be a partial tear where it's not all the way torn, which is usually a good thing. Here's 2 pictures. On the right side is a rotator cuff, which looks beautiful. Okay, the tendon right here, this shiny object comes down here and it attaches right onto the bone. Now this side, the tendon's up here, the yellow bone's down here, and the tendon, oops, let me go back. the tendon is not attached to the bone. I'm able to put this little metal grasper underneath the tendon, between the tendon and the bone. So this is a rotator cuff tear, okay? Now, the options that you have when you have a rotator cuff tear, you can live with it. You know, it's not cancer, won't kill you. You could live with it, but most people don't choose that option because it hurts, and living with it really doesn't help them much. You can treat just the symptoms. For example, you can take some medicine, or you can come see me and I can give you a cortisone shot, and that'll make you feel better for a little while, but that doesn't cure the tear. So it's only a matter of time before you start hurting again, okay? Or the third option is to fix it. And I'll talk to you a little bit about that. So an arthroscopic rotator cuff repair. So when I say arthroscopic, that means it's minimally invasive. It's just through little nicks in the skin. And the advantages of fixing a rotator cuff tear is that the long-term outcomes are really good. About 92% of patients get significant or complete pain relief. About 94% of the patients say they are satisfied and are happy they had the surgery. Most patients get strength improvements as well as long-term. We know that if you fix a torn rotator cuff, patients' shoulders survive longer than if you don't fix it. If you don't fix it, frequently it will eventually go down to arthritis. The disadvantages of fixing a rotator cuff is that you have to go through surgery. That's the bummer. And the recovery is long. It's not short. I kind of prep patients for at least 4 to 6 months of improvements, and actually it continues to see little improvements for an entire year.
SpeedBridge is a
so here's a video
that combines.
I'm going to mute it. Here's a video of a rotator cuff repair. I'm going to show you an animated video because some people get a little grossed out with the actual video. So, so this is an animation of a shoulder rotator cuff tear, and it's actually very similar to the way I do it. So I work through these small incisions in the skin called portals. I have the camera, which I can place in different portals to see different parts of the shoulder. Then I'll prepare that bone bed. I'll roughen it up a little bit because all the healing comes from the bone. I'll put these things called bone anchors. These anchors are made out of a tricalcium phosphate material. So they actually have calcium in them, so they kind of become part of your bone. People wonder, is there metal? Am I going to go off in a metal detector? No. All these anchors are what we call bioabsorbable, which means your body over time just absorbs those. Now, once the anchor's in the bone, we have these sutures that come out from the anchor, and we pass those sutures through the torn tissue. So there I'm passing it. Now another one's passed. So we see a white and a blue suture that are passed through the torn rotator cuff. Then I bring those sutures over top of the bone, and then I insert them into 2 additional anchor sites. And you'll see here, as I pull that pulls that rotator cuff nicely down to the bone. And then I'll place my anchor here. There we go. The anchor's going in, and that's one of my fixation points. And then we'll get my last fixation point here. I'll use some other sutures to kind of tie down any corners that we need to. And then we'll fix that last anchor there. And that's called what we call the SpeedBridge rotator cuff repair. So that's a very incredibly strong rotator cuff repair procedure. Even in soft bone, I do, you know, sometimes we see patients with relatively soft bone or some osteoporosis. It still tends to hold very well, even in soft bone. So that's the basics of how I do the rotator cuff. I'll finish off with a couple other shoulder problems that you may or may not have heard of. Frozen shoulder is very common. That's where the inside of the shoulder joint, this thing called the capsule, just gets inflamed. We call it idiopathic. That means we don't know why it happens. Sometimes it's a minor trauma that initiates it, but it gets really inflamed. And honestly, of all the shoulder conditions I treat, this is probably the most painful shoulder condition. Good news, 95% of the time we can get it better without surgery. So that's a great news. Labral tears. These labral tears typically happen either acutely in young patients who have a football or a throwing injury, or they happen chronically, repetitively over time. You know, I see a lot of 50-year-olds they've played a lot of sports in their lifetime. They're still trying to play tennis and everything, and they get these chronic labral tears. The labrum is the lining around the joint there where the ligaments attach. Arthritis, I know you've heard of arthritis. So on the left is a normal joint. It's nice and smooth. You got a good space between the two bones. On the right, there's no space at all. You have a big bone spur here. So this thing is worn out. That's arthritis. Really the only treatment for that, other than shots and conservative routes, is what we call arthroplasty. That means a shoulder replacement. And those work very, very well. But I tell every patient, avoid it for as long as you can. Once you get to the point where nothing else is working, shots aren't working, therapy's not working, nothing's working, then think about getting the shoulder replacement. Injections. Injections are common ways that I treat shoulders. I do probably 10 or 15 every clinic, and I can put them in different places depending upon where your pain is to try to get you the best shoulder possible. So that's it for me. I'm gonna now open it up to the questions. Let's see.
I don't see, oh, here we go.
Okay.
Okay, do you see that one? What is it when the shoulder hurts from leaning on it?
So when you, can you all see me?
Yes.
Are you seeing me? So when you lean on the shoulder, like